So bowel cancer is cancer of the lower gastrointestinal tract. So the gastrointestinal tract essentially runs from the mouth all the way down to your bottom. Large intestines where a lot of the water absorption takes place. And it's the large intestine that's otherwise referred to as the bowel. So for bowel cancer, it's felt that there may be some dietary factors involved. Red meat is one factor that's often spoken about, that eating a diet rich in red meat, and especially processed meat, can increase your risk of bowel cancer. Diabetics can have a slightly increased risk of bowel cancer as well, as can patients with chronic inflammatory bowel disease. The key headline things to look out for would be bleeding from the back passage, so fresh, bright red bleeding from the back passage. A change in bowel habit, so if your bowel habit over time has completely changed and you've become more prone to constipation or more prone to episodes of diarrhea. And then anemia, so losing blood can make us become anemic. So the patient may become very pale, may feel tired, lethargic, withdrawn, and again this can be picked up very easily in a blood test. So unexplained anemia, a GP will often refer for a camera test or an endoscopy. Well, the most common site after local spread through to lymph nodes, and the lymph nodes are like glands. We have glands all over our body, and it's often the first port of call. So a cancer can spread via the glands, or it can spread through the bloodstream. For bowel cancer particularly, the most common site of spread is the liver, and the second most common site being the lungs. It's very common. It's very common, so 30 to 35,000 cases a year in the UK, and it's the fourth most common cancer. And there's currently a screening program as well within the UK, so any patient over the age of 60, any person over the age of 60 now, between the age of 60 and 74, is invited to screen for bowel cancer. The uptake is improving, and essentially what people have to do, it's not particularly glamorous, but they have to give a sample of their poo, send it off in an envelope. It's not very nice for the person at the other end, but that is then tested for blood. If blood is picked up in the poo, then the patient will be invited for a camera test. There may be dietary factors, lifestyle factors, as we've already discussed. Red meat may be a factor, but the population are living longer. We're getting older. The average age now is people are living well into their 80s. Cancer is predominantly an age-related disease, and the majority of patients I see with cancer are 70 or older. So whereas 30, 40 years ago, people died of infectious diseases, they died of heart-related diseases, were far more effective at treating those. Patients are living longer, they're getting more cancers. So many patients with bowel cancer will actually be cured. And these days, even bowel cancer that has spread to other parts of the body, for example the liver, treatment can potentially be curative. But you know, there are, for patients with bowel cancer that has spread, for those that do succumb to the disease, the average survival now is much better than it used to be, even 10 years ago. The average survival now is about 2.5 years. We have come a long way. I think the advent of the screening program especially is making a huge difference in that we're detecting more bowel cancers at an earlier stage. And treatments are advancing. Surgical treatments have advanced greatly in terms of how cancers are removed, where they now tend to be removed now with a large sample of lymph nodes and all the fatty tissue around the tumour as well. There have been great advances in radiotherapy treatment, which is X-ray treatment for cancer, and chemotherapy as well. And in 5 to 10 years' time, I think we'll be personalising therapy a lot more. So the choice of therapy will be tailored to the individual patient. And we may also be looking at drugs that stimulate the immune system as well, looking at stimulating the immune system to fight cancer. So whilst we've come a long way in the last 10 or 15 years, we have a long way to go.